guys, today we are going to do a treatment video on our intern Dylan here. Dylan's a hockey player at Lewis University. He's been kind of hanging out with us, learning the ropes of the chiro business and all that type of stuff. But he came in today and he's got a little bit of trouble with cervical rotation, so looking over the shoulder in both directions. And we know from our studies that about 50% of the cervical rotation comes from that C1, C2 joint. And so we're going to show a seated upper cervical adjustment today, as well as a little bit of the rehab exercises that we would pair with the adjustment if you were to come in, for a visit. Okay. So we already kind of worked Dylan up, but basically when we go to rotate Dylan this way, he's a little stuck into rotation coming this way. Okay. So really it's both directions. We're a little bit stuck. We'd like to see him a little bit further. We'd like to see that nose rotate a little bit more. Okay. Now when we go to palpate C1, C2 here, right under the occipital ridge, we're feeling just a little bit of that joint restriction. Okay, it's kind of tough to feel up here so high. You're really going to feel C2 a lot better than C1. Okay. And then as we go down the cervical spine a little bit more, we get a little bit more of this free joint play. So it's really that upper cervical area that we're going to focus on today. Okay, the adjustment we're going to do, different schools of thought will call this adjustment different things. The way we were taught is essentially we're going to go seated position, index to pillar, and it's going to be a push maneuver. So the whole name is a seated index push maneuver for a C1, C2 joint. Okay, and we'll do it bilaterally. Okay, so we'll kind of walk you through it. So we're going to start off kind of palpating the mastoid process. We want to be just underneath that to where we can get to C1, C2. Okay, he'll probably tell you that's a little tender when I'm putting pressure into it. Okay, so first thing I'm going to have him sit up nice and tall. Okay, you're about the perfect height for this adjustment. Put your back of your head right into my belly here. Okay, I'm going to get my contact right here. So it's that C2 index contact. Okay. I'm going to have him kind of lean back into me. Right, we're going to laterally flex over, and then we're going to rotate. Go ahead and relax for me. Good, and come back. Nice. So that went pretty well. We're going to do the other side here as well. Doesn't take much to move those joints. Go ahead and lay back into me a little bit more. Come just a little bit lower here. Go ahead and drop that shoulder. Okay, so we went after C1, C2 there, okay? Now, typically in office, we're not just gonna adjust you and kind of throw you out into the wild, all right? So with Dylan's presentation here, Dylan, I'm gonna have you turn the face sideways here, okay? We're gonna send him home with some McKenzie chin retractions, okay? We'll keep it real basic today, all right? So we'll do a demonstration on how we want this done. First thing is we want thoracic spine to be totally upright, okay? So good posture here. I'm gonna use my hand to kind of guide his chin back, and we're going to repetitively chin tuck, okay, or chin retract, okay? The goal is I always tell people, if you put your chin on a table or my hand here, that chin should go straight back like that. So why don't you show them a couple reps there, just like that. It's kind of like you're like grooving to disco music. That's exactly right, good job. Now for the first few, I'm going to help him, okay, just kind of so he has the motion. This would be an example of doctor-provided overpressure, okay? If he can tolerate this, great. If this lights up his symptoms a little bit more, then we would have him just generate the pressure. So show a few of those as well. Good. We're making sure, yep, so we had a little bit of flexion there, making sure it's just chin retraction. And back, good. Like that. Now with an upper cervical complaint like this, we know that we want to work those deep neck flexors, okay, especially if we've got that kind of jutted forward head posture. So I'm going to send him home with a lot of reps of these, probably 4 or 5 sets of about 12 to 15 of the chin retractions, and he's going to hold that at the very end. So show him just a few more. Good. Nice. Keep going. Let's do one full set here. Good. Keep chin tucking. Give yourself a big, ugly double chin. There you go. Nice. Cool. You can rest there. So you can go ahead and face the camera now. Face the camera. So that's just a quick example of kind of something we would do here in office in terms of treatment for that upper cervical, kind of some pain, some limited rotation presentation. Can also work really well for like cervicogenic headaches. And so that's just a real quick example of kind of what we would do here in office for a patient like Dylan. Okay, so if you guys are experiencing any sort of cervicogenic headache, dizziness, pain with rotation, maybe when you're you're checking your blind spot, kind of hurts you a little bit. Make sure you visit our website and make an appointment. We can take care of you in the office here, all right? Have a good one, guys.